to talk about the upper GI bleeding. So some of the important MCQs in relating to the upper GI bleeding. Number one MCQ which you must have to remember, most common cause of upper GI bleeding, answer is peptic ulcer disease. Peptic ulcer disease. Now see here some important point. Second, most common complication of peptic ulcer disease, answer is bleeding or hemorrhage. Now peptic ulcer disease, please remember, it can be gastric ulcers, it can be duodenal ulcers, but most common it is the duodenal ulcers. And most commonly, please remember, the duodenal ulcers have tendency to bleed. Okay, tendency to bleed. Now we must have to understand some of the clinical correlations in relation to the upper GI bleeding in relation to the peptic ulcer disease. So number one, see this diagram. In this diagram you can see this is the celiac trunk, and from the celiac trunk three branches are coming out. One is this branch, which I am highlighting in green color. This one in the diagram, it is also shown in the green color, that is the left gastric artery. Second is this one, this is the splenic artery. So this is the first branch, this is the second branch, and then this one artery, that is your common hepatic artery. So these are the three branches of the celiac trunk. From common hepatic artery, this artery is important, which is going past posterior to the duodenum, that is the gastroduodenal artery. Now see here, all students, most common cause of peptic ulcer disease, most common cause of upper GI bleeding, it is the peptic ulcer disease. And most common peptic ulcer disease, it is the duodenum ulcer. And duodenum ulcer, please remember, most commonly it is in the first part of duodenum. So first part of duodenum, mostly it is seen. Okay, so duodenum ulcers are most commonly seen. Now three clinical scenario you must have to remember. If the ulcer is present along the lesser curvature of the stomach, this one. So if the ulcer is present along the lesser curvature of the stomach, which artery is going to bleed? Answer is left gastric artery. This is your MCQ number one. Second, if the ulcer perforates posterior in the body of the stomach, which artery is going to bleed? Answer is your splenic artery. And third clinical scenario, if the ulcer is present in the first part of duodenum. Please remember, duodenum ulcers most commonly seen in first part of duodenum. Duodenum we divide into fourth part, D1, D2, D3 and D4. Okay, so you can say D1, D2, D3 and this is D4. D4, D3, D2. So this is the D1 part. So most commonly the duodenal ulcer is seen in the first part of the duodenum, and if it perforates, if the duodenal ulcer perforates posteriorly, not anteriorly, posteriorly, then the artery which is going to bleed, answer is gastroduodenal artery. Okay, and if the duodenum ulcer, so see here, duodenum ulcer perforates posteriorly, gastroduodenal artery is going to bleed. If the duodenum ulcer perforates anteriorly, so this artery, gastroduodenal artery, it is passing behind the first part of duodenum, not in front of the duodenum. So if it perforates anteriorly, there will be air under diaphragm. Okay, air under diaphragm. So see this diagram, this is an X-ray chest PA view of the patient. Okay, or X-ray chest PA view or AP view. And now you can see here that this is the collection of air under diaphragm. Okay, air under diaphragm. This is normal. This is normal. Okay, so this is how you are going to check these clinicals. Upper GI bleeding, please remember, most commonly the first investigation which you are going to perform in upper GI bleeding, answer is endoscopy. Okay, answer is what? Endoscopy. And one more thing which you can remember here is that the Mallory-Weiss syndrome, which is also one of the cause of upper GI bleeding. So in Mallory-Weiss syndrome, please remember it is characterized by longitudinal tear. Okay, longitudinal tear that is present in the involvement of mucosa and submucosa. So mucosa and submucosa is involved, and please remember most commonly it is present, most common site is the cardia, just below the JE junction, gastroesophageal junction. Okay, most commonly seen in alcoholic males. Alcoholic males. So risk factors are what? Repeated vomiting, forceful vomiting, retching. So all can lead to the formation of longitudinal partial tear in the JE junction, and patient can develop bleeding. Okay. In this scenario also, the most common blood vessel which is going to bleed, again answer is your left gastric artery. Left gastric artery. Okay, so see here, see this diagram. So then, well, this is the esophagus, this is the stomach, so this is the cardiac part. So here it can be JE junction, and again the blood vessel which is going to bleed, answer is your bleeding from Mallory-Weiss syndrome. Again the answer is your left gastric artery. Clear to everyone? Thank you.